This module, Patient Skill Development, will build off of the previous presentation on assessing transition readiness. By the end of this module, you will be able to list specific steps for making a transition plan with patients, discuss the Florida HATS tools with patients and parents and caregivers, and identify activities and tasks for patients' transition plans. The patient's goal during transition preparation is to gain the knowledge and skills to manage their healthcare preparation independently. The provider's and parents' shared goal is to support the patient with planning, tools, and coaching. Skill development is a step-by-step process that involves planning and follow-up. It is best for patients to receive gradually increasing levels of responsibility over time while they have support from family and pediatric providers. Self-management expectations instill in patients a sense of responsibility and ownership of personal health. In addition to the health management skills that all youth must learn during their transition, youth with special healthcare needs have important condition-specific skills to master.
In terms of balancing my healthcare with everything else I do in life, I'd say that there aren't too many differences between myself and the average person. The average person has things that they have to take care of that no one else does. For instance, if somebody has a child at a young age, and they've got to take care of that child as well, and in addition to taking care of their own life. Well, I kind of have a part-time job as somebody else might with a child, or a full-time job as the case may be, in taking care of my body, and so I might have to take an extra half hour before I go out with friends to make sure I get my treatments done. Make sure I plan an extra hour during the day sometime so I can get 2 sets of treatments in. So I make sure I'm breathing clearly all day and whatnot. So I just have to kind of work in time throughout the day based upon what my requirements are. And everybody's requirements are different. And, but I always just kind of start with how I'm going to do my day anyway. If I have a specific schedule I have to keep, then I work my healthcare in around that schedule. I try not to do, I don't know if this is, normal doctrine from professionals or my mom even, but I try to work my healthcare into my day rather than my day into my healthcare. So I just try to work around it rather than having my life work around my healthcare.
Do you think that
Mm-hmm. I was always given a lot of responsibility in terms of my healthcare. So today I still take a lot of responsibility with my healthcare. Good example of that is after I developed diabetes after my first year in college. I learned about that all by myself and maintained that all by myself. My mom has absolutely no clue about what it takes to maintain that, and consequently she doesn't bother me about it. So that's probably another tip. You could just let them do it all by themselves from day one. But so
you would say that it's been really beneficial for you in the way that at an early age
mm-hmm.
you were encouraged to do that?
Yeah, I was encouraged to do things for myself at an early age and am now, and so that I think that will help me along in the future as well. And I'm not going to be able to call for help when I run into a problem. I have to figure it out by myself. And I always have, especially when I went off to college, you didn't have people around to ask about what to do. So you have to try to figure it out for yourself in the best way possible.
The next few slides identify specific steps for making a transition plan with patients. Use the track results to determine which skills the child has yet to attain. Discuss the results with the patient and the parent or caregiver to identify their priorities among these skills. What does the patient need to develop a particular skill? The planning guide worksheets support this step and identify individual patient needs. The patient needs might include more maturity, coaching, or practice. Plans will vary for individuals, but should be task-based. Establish a timeline that builds gradual independence in all of the patient's medical tasks. If the planning guide reveals that the young person has many areas that require goals, choose the most important 2 or 3 areas rather than making a goal for every area. The transition plan is the 4th worksheet from the 3 transition planning guides, with dedicated areas to write out the transition plan matched to assessment worksheet categories. Recall that for early and middle adolescents, the transition plan is a parent or caregiver worksheet. For late adolescents, the transition plan moves to the patient worksheets. Later in this presentation, we will discuss patient tools and activities for use while carrying out the plan. Follow up with the family about 1 month after they create their plan. Ask the patient and parent or caregiver about successes and barriers. Complete reassessments annually to encourage the patient's progress through the transition stages. Celebrate newly mastered skills and make new goals for the coming year. If the patient did not achieve their goal, identify the difficulties they encountered and adjust the plan. Consider your practice's visit workflow and follow-up activities. Where do the steps for creating a transition plan naturally fit? Is there one individual who should work on all 5 steps? Should 2 people split up the tasks? This slide will automatically advance in 1 minute, giving you time to jot down answers to the questions on this screen.
I never really thought that I had any barriers from the standpoint of respiratory trouble. I remember my mom thought I was going to just drown my first time, and I ended up doing well, not great, but I ended up doing well in my first competitive heat, and so I did just fine. And she was like, "Well, we'll let him try this." I remember a lot of people, in the healthcare profession, doctors and whatever, were surprised to learn that I was swimming, because it is very taxing respiratorily speaking. But I guess I just learned how to control it. I am a lot better in sprint races. I kind of max out after 200 yards, and so after that it gets pretty rough. So doing the 500 or the mile, 500-yard race or the mile race is pretty tough. I can still do it, but I'm not nearly as competitive. Or I should say was as competitive, because I'm not so much of a swimmer anymore. But I guess I should be. But no, I never really experienced too many problems with regard to my respiratory system and breathing. I never really saw it as a barrier. More, I guess the only barrier I saw was being able to physically do it, get in the water and be competitive. And after the first couple of years of swimming, I became competitive and finally ended up at a couple state meets and whatnot. So and even joined a few very highly competitive United States swimming teams and whatnot, USS teams. So that was interesting to me, and I really enjoyed it during high school. I don't think I was held up too much by the respiratory. Yeah, I think it did more to help it than anything else. So I gained a lot of benefit from in terms of my pulmonary functions and whatnot at clinic due to swimming. So it helped me a lot more than it was a barrier.
Do you think there's any particular, one or two things or one key thing that recurred in your life that helped you be a person that strives for your goals, goes for what you want, goes for your dreams? I mean, you've done a lot of things. You've been in competitions and you succeeded in
I suppose it's probably I've had a lot of good role models around my family. My mom and dad are all, both very hard workers, but also extended family, uncles, aunts, grandparents, all very hard workers, and they always seem to set goals and reach them, and then set new goals and reach those. So I guess I've just had a lot of good examples, and it's kind of instilled in me a kind of an attitude that if I set a goal, I either change that goal or attain it, or set a higher goal or whatever I'm going to do, but not to give up on it. I don't really believe I have too many barriers in front of me. I know there are barriers, but they're no different for anyone else. So that's the kind of attitude I use. Okay. When I went away to college, there were a few issues I had to deal with in terms of being equipped to handle healthcare. One of them was simply just obtaining an air conditioning unit in the dorm. That was fairly easy to do. It was a couple $100 for the year to get that in my room. That wasn't a big deal. After that, I believe there was one other thing, that was obtaining nurses at the health center to do physical therapy for me, and I ended up. They ended up being very nice people and very easy to work with, and on a daily basis, or not so daily basis as it turned out, I'd go over to the health center and get my physical therapy, and especially when I knew I was getting congested and whatnot, I'd make sure I'd step up on those treatments, and I'd go over there and between classes and get my physical therapies. And other than that, I don't really know how much different my experience transitioning from high school to college was any different than anyone else's. I just had to arrange some things to so that I could stay healthy.
So it was a good experience going away?
Yeah, I never had any major problems going away. I developed diabetes after my first year there, and I noticed I was losing some weight and stuff, and having some little bit increased trouble breathing, but I've never had severe trouble breathing, maybe once that I can remember. But no, it was actually quite easy to manage up there. Everybody was very accommodating. Didn't have too much difficulty at all, really.
Is that something you recommend for people?
Go away to college? Oh, sure. Yeah, most certainly. There's a lot of learning to be done at college other than just classwork.
Now that you are familiar with all of the available tools, let's identify potential activities and tasks for patient transition plans. Recall the 8 steps of the transition process, supported by the Joint Statement on Transition, the 6 core elements, and the Florida algorithm. The first 2 steps pertain to assessment. The remaining 6 steps are integral items to address in the transition plan. Explaining the necessity of routine medical tests is one potential activity for the patient's transition plan. This skill supports communication with multiple providers or insurance companies. Patients who will ultimately manage personal attendance for daily tasks should rehearse directing others, such as family members. This develops the patient's ability to describe their needs and provide correct instructions. The Center for Independent Living in your area is an excellent resource for training. Medication management is a very important skill set for self-management. Different skills from this set are appropriate for different transition stages. These activities also transfer to other areas of transition. It is important for patients who use medical equipment to become responsible for its use, care, maintenance, and ordering. This activity should eventually include obtaining insurance approval for the new equipment. Interacting with healthcare providers is a specialized social skill to practice and master prior to the patient's care transfer. Adding different tasks for the patient's one-on-one time with the PCP into the transition plan encourages the patient to practice different aspects of managing a doctor's visit throughout their transition stages. One way to record medical information and simultaneously instill responsibility is to have patients keep a medical journal. Medical journals and templates are available from a variety of commercial and non-commercial sources. It is also simple to make a medical journal with a 3-ring binder and dividing tabs. The two-page healthcare transition summary from Florida Hats is one example of a medical journal. My Health Passport is a different type of medical journal, specifically designed for patients with complex conditions to use with new providers during the transfer to adult care or ED visits. Creating an up-to-date emergency summary page is an excellent way to keep important medical information readily available. Storing copies in multiple locations increases the patient's likelihood of remembering to use it. Potential locations include inside the full medical journal, near the phone, on the refrigerator door, or in the patient's book bag. Patients may prefer e-summaries to a paper medical journal. Electronic tools allow for increased independence and privacy during middle and late adolescence. Potential tools include patient portals in the EMR, simple functions in the patient's cell phone, such as their contact list, the note page, the alarm, and reminder, or downloadable applications. My Medical keeps track of test results, stores medical histories, and monitors chronic conditions. It works with iPhones, iPads, and Android phones. My Med Schedule sends emails or text reminders when it is time to take medications or get a refill. Originally designed for post-transplant patients, it does not require a smartphone. These examples are not an endorsement of the products or their parent companies.
I think as doctors, this can be helped to be cultivated by encouraging the patients to make their own appointments. We talked about stuff like this in one of our meetings, to have the student or the patient make their own appointments and call in their own prescriptions and keep track of when they need their prescriptions refilled and when they need to get those, and keep track of taking their own medications and stuff. And there's so many things in life that they need to be able to do on their own, but as doctors, I think if you can help push that, that would be at least one little category that these people can be independent and learn to take care of themselves.
The Florida Hats patient self-management booklets are excellent tools to foster independent patient skill development that is also developmentally appropriate. Like the planning guides, there are 3 self-management booklets separated by the transition stages. Each booklet provides age-appropriate preparation activities for youth to complete independently. Each booklet provides material for youth with special healthcare needs, a section with healthcare terms and definitions, and ideas for staying healthy. The self-management booklets focus on the youth's increasing responsibility throughout the transition stages. Booklet activities encourage the patient to prepare for a situation before it arises. The material instills confidence that the patient will master new skills. The first booklet, Since You're Not a Kid Anymore, emphasizes the link between healthcare skills and independence. By highlighting growth from elementary school to middle school, this guide encourages the patient to think about the future. This booklet targets patients in middle school. The second patient self-management booklet reinforces the youth's self-efficacy during middle adolescence. This booklet has a slightly different format to highlight the major life changes that begin at age 18. This final section identifies dovetailing school transition activities for patient skill development. Before continuing with this section, consider the differences in approach between educational and medical interventions. The Individuals with Disabilities Education Act, often referred to as IDEA, regulates special education, requires schools to provide each student with an individualized education plan, or IEP, and mandates transition activities. Students who have a chronic health condition or disability but are not eligible for services and supports under IDEA may be eligible for accommodations under Section 504. The purpose of Section 504 of the Rehab Act is to assure that persons with disabilities have equal access and opportunities to participate in all aspects of society. IDEA defines transition services as a coordinated set of activities for a child designed within results-oriented process that is focused on improving the academic and functional achievement of the child with a disability to facilitate the child's movement from school to post-school activities. Accessing healthcare is both a functional skill and a critical component of independent living. Services that improve an adolescent's ability to manage their own healthcare needs must be part of IEP transition plans. Infusing healthcare transition-related activities into the school setting through IEPs and 504 plans has several advantages for students. Skills used in healthcare transition are similar to the skills in the IEP transition plan. Further, schools are a practical, comfortable, and natural learning environment where a number of different individuals may be available to support the adolescent. Work with the patient and their school to include healthcare transition-related goals and activities in IEPs and 504 plans.
And I'll go back to the age when I was 12 and had my first IEP. And having that first IEP, you don't know who to really involve. You don't know whether to involve your doctor, of course you're going to involve your teacher, and of course you're going to involve mommy. But do you involve the doctor? The answer to that is yes, because then the doctor can be informed of what your goals are in life without you having to retell them maybe an hour later.
I know when I was growing up, this is kind of touching back on learning skills at a young age. I had a person that worked for Jordan School District come out to my house maybe once a month to help me learn how to adapt my house to make it more accessible for me as far as marking appliances so I could work them by myself. And I think that's important in becoming independent at a later age is, learning those things at a young age and having it be a part of your life before you have to go out in the world and experience the things that brings.
Here are additional resources for patient skill building. The Florida Centers for Independent Living website offers an interactive map to locate nearby offices. Search using the map or by county. Project 10 assists Florida schools in improving secondary transition services to students with disabilities and their post-school outcomes. The Illinois Transition Care Project created a presentation for patients, parents, and caregivers entitled Health Goals and IEPs. It is an in-depth presentation on working with the IEP team on building healthcare skills through the Educational Transition Plan. The University of Wisconsin's Weissman Center also offers a video training on healthcare outcomes in IEPs. Create a transition plan with patients to address 1 to 3 skills. Tailor the plan's tools and activities to individual patient needs. Update the plan and its activities annually when you complete reassessment. Use the links from this course's toolkit to access the resources from this module. This module's activities are relevant throughout the transition process. Module 6 identifies specific areas to address before the patient turns 18. This closes Part 1 of the course. Return to the AHEC website to take the post-test and evaluation for CME and continue on to Part 2 of the course.